Hey there, Jay Wolf, amazing atheist here. So here's the thing. You ascribe the problem to be that the government is not involved enough, which is never the fucking problem. That's almost never going to be the case. The case is always that the government is far too involved. Now, here's the problem. FDA, Medicaid, medical licensing, insurance regulations, those things are the problem, okay? Those things are what's driving up your medical costs. That's why we pay. That's why we have to pay hundreds and sometimes thousands of dollars to go to the fucking doctor in this country. All these pharmaceutical companies are giving all this money to the government, right? And the government passes all these laws that make sure that only these huge mega conglomerates can stay in business and that no small-time people can compete with them. They will charge you $800 because they know that they can get away with it. And they don't care if you have to mortgage your house. They don't care what they have to do. They don't have any competition. If they had to compete with other people, you'd see price wars for medicine just like you'd see in anything else. You'd have Walmarts where you could go. You'd probably have the Walmart equivalent of a hospital, you know, or something like that, and where people could go and get cheap treatment. I mean, it wouldn't be great treatment because it's cheap, and you know, cheap isn't always good, but it would be treatment. And in a system where you do this universal health care thing, it's shown time and time again that the care becomes substandard. That's why up in Canada, where they have this, they have a universal health care plan, you have people coming down from Canada to the U.S. to get medical treatment because there's such a long waiting list for medical treatment up there, or because they feel the medical treatment is substandard up there. The reason for this is because when everywhere is free and everyone knows that the government is going to take care of the bill, there's no incentive to be the best. The only system of healthcare that's going to work for everybody, that's the only system that's going to be really effective for the entire population, is if the industry is completely deregulated, the government doesn't get involved at all, and people can choose where they want to go. And you know, of course, you keep medical malpractice suits to keep them in line, and you don't allow them any sort of special powers. You don't have them putting their money into the government's pockets and the government protecting them in turn. You know, and you allow their reputations to be built by word of mouth, and they're going to have to live by their own results instead of just living off of government funds. And you know, they're not going to be. They're going to be worried about turning a profit, and the money is the thing that motivates everybody in this country and everybody in this world for the most part. So if you incentivize people to provide good medical care, that's the way good medical care is going to be provided. So when Warren 25 or you say that it's run too much like a business, that's not true at all. The problem is it's not run at all like a business. It's run like a little leech off the government. And basically, most of your money is going towards lining the pockets of the government. So we have one system where the government is dishing out money that, of course, they get from the people by force in the form of taxes. And we have another system where the government is actually making money off of your suffering. And the middle ground is a system where the people who are actually providing the medical, this medical service are the ones that are making the money. And there's no middlemen, there's no complicated licensing procedures, there's none of that crap. All there is you and a doctor, and they have to go to medical school, obviously, but that's the long and short of it. That's all that you need. And if they... So, I mean, there's obviously even problems with that system, but I think that would be a lot less problematic than either the universal healthcare system or our healthcare system, which are really twin devils, in my opinion. But I hope that I've been somewhat persuasive. I know I'm not the best at explaining this issue because I've never really given it much thought. it's a very tricky issue, but I hope that I've given you at least one other perspective to consider. And thank you very much. Peace.